Let's talk non-hormonal birth control. So if you're somebody on a hormonal-based birth control and maybe want to come off the synthetic chemicals, here are 3 options I would check out. Number 1, the Paragard, copper IUD. So with any IUD insertion, it is a little bit painful, but the Paragard gives you the same benefits as hormonal birth control with no hormones. That's a huge plus. However, coming off a hormonal-based birth control onto a non-hormonal means that hormones are going to shift. So the few menstruation periods that you might have, maybe 2 to 3 months post, might be a little rough. Your symptoms might be a little hot. That's very common. We recommend an herb called Blue Plurum or a product called Fem Premenstrual to help assist in reducing those symptoms until your body gets used to the new birth control. Number 2, the diaphragm. The diaphragm is a plastic dome-like material that covers the opening of the cervix to prevent pregnancy. I really like this option. It does require the user to take the diaphragm and spermicide and keep them with them, obviously putting it in before intercourse and then taking it out and cleaning after. So there is some maintenance, but it is a very, very good option I encourage you to check out. Number 3, basal temperature testing. Now, I really do like this option, but warning, it's subject to failure. You're going to want to be accurate, and even when you're accurate, some people will get pregnant. But many of my clients do enjoy the benefits of this option. So what you'll want to do is take your temperature first thing in the morning before you do anything else, okay? And you'll want to do that for up to 2 months, at least 2 months. Then you'll get an idea of your temperature cycle. You'll find the day where your temperature raises about 0.5 degree. That means you're ovulating. So now that you know when you're ovulating, you can go ahead and set your dates of when you're not going to have unprotected sex. It starts 5 days before ovulation. And it lasts till 3 days past ovulation. That's a conservative model. So in that window, no unprotected sex. Now, some people tell you that you should have about a 14-day window versus an 8, meaning during menstruation till 3 days past ovulation should be your window. So it depends how conservative you want to be, and you're going to want to consult with your physician and see what they suggest. Now, like any birth control, moving birth controls, coming off birth controls, there can be side effects. Do not take this lightly, so I highly suggest working with a practitioner or a functional nutritionist in assisting you in the steps of moving to a non-hormonal birth control option.